put on PPE upon entering the room along with sanitization. Hey, how's it going?
Pretty good.
Pretty good. My name is Caleb. I'm just going to be taking some information here for you today, okay? Can you go ahead and tell me your name?
My name's Venus.
Venus. All right, and your last name?
Skowronski, which is SKOW. RONSKI.
Okay, and your date of birth?
11/04/99.
499. All right, and what brings you in here today?
I've just been having like extreme breathlessness.
Breathlessness?
Yeah.
Okay. So some dyspnea. And then where would you say you're mainly feeling this shortness of breath?
In my lungs?
Really in your lungs? Okay. All right. And is there any particular kind of shortness of breath?
I've just been noticing it more now that the weather is nice out and I walk more.
Okay.
It's just more noticeable when I'm outside walking.
More noticeable when you're outside walking? Okay. All right. And then would you consider it to be wheezing, or what kind of shortness of breath would you say this is?
It's more I can't get my lungs to fully expand.
Okay.
I take a breath and I'm I know I normally can take a deeper breath.
Right. So trouble getting a full breath, is that correct?
Yeah.
Okay. And on a scale of 1 to 10, how severe would you say the shortness of breath is?
When I'm not moving around, there's no issue. But when I'm walking and noticing the issue, I'd say it's maybe a 5 or 6 out of 10.
Okay. 5 walking, no issue standing still. And does this change at any certain points of the day? Is it mainly just kind of when you're moving?
It's mostly when I'm moving around, yeah.
No particular time or anything around that? Okay. Was there any context that you noticed you initially started getting it?
Well, I noticed it started happening more of the week before when I had to go walk to my classes. And it was more uphill from the side of where I have to park. So it's a nice uphill incline.
Okay. Was this a different route to your classes this time, or do you usually walk this way?
I usually walk this way, but I did take 2 weeks off from different travel and work stuff.
Okay. After class hiatus. All right. And then do you have any other associated symptoms with this?
Mm-mm.
No, you're not experiencing anything else. It's mainly just the shortness of breath? Okay. All right. Do you have any past diagnoses or conditions?
When I was a lot younger, I had exercise asthma, induced asthma, sorry. But then when I got older, that was taken away.
Okay.
Yeah. Child, when I say.
Around what age would you say that was taken away?
When I was around 20, it was no longer really an issue.
Okay. Are you on any medications right now?
Just my anxiety medication, which is Lexapro, and that's it.
All right, and how frequently are you taking that?
Once a day.
Once a day. Okay. And then do you have any allergies?
Just pollen and dander, but none known other allergies.
Pollen and dander, and how severe would you say your reactions are?
When it gets to springtime and we have all the pollen everywhere, pretty severe, but throughout the year otherwise it's easy, fine.
Okay. And what kind of reaction do you usually face from those?
The typical I don't want to say sickness of stuffy nose, congestion,
Gotcha.
Sneezing.
All right, let me just get that down here. All right, I'm just gonna ask you about a couple other things, okay? Are you experiencing any chest pain or lung pain along with this?
I'm noticing this is gonna sound weird, I'm noticing my lungs.
You're noticing your
Yeah,
lungs?
and so
okay.
it hurts, and it's not chest, but my lungs hurt.
Mm-hmm. All right. Do you have any abnormalities you're noticing with your heart rate?
Not that I've noticed.
Nothing there. Okay. A cough? No cough. Have you noticed any excess spit or discoloration?
No.
No, nothing there. Okay. And then any irritation in your throat?
It's been a little bit drier recently.
A bit drier?
Yeah.
Okay. And then do you have any fever or fatigue right now?
I'm a little bit tired, fatigued, but no fever or anything.
Okay. All right. Well, I'm gonna get these all to the doctor and we'll get back with you shortly, okay?
Thanks.
All right, thank you.